medications and the epidural, it becomes necessary to continuously monitor and check the progress of the mother and the fetus. Monitoring procedures further strap down the mother and can cause irritation or an increased chance of infection or side effects. There is also a dramatic increase in interventions at the time of delivery after a woman has had an epidural, most alarmingly cesarean deliveries. The following is a study and the results found by the Department of Obstetrics and Gynecology, St. Luke's Hospital, Kansas City, Missouri. Objective. Our purpose was to determine the effect of epidural anesthesia on nulliparous labor and delivery. Study design. Normal nulliparous, how do you spell that word? Nulliparous women in early spontaneous labor were randomized to receive either narcotic or epidural anesthesia. Result. When compared with the group receiving narcotic anesthesia, N equals 45, the group receiving epidural anesthesia, N equals 48, had a significant prolongation in the first and second stages of labor and increased requirement for oxytocin augmentation, which is Pitocin, and a significant slowing in the rate of cervical dilation. Epidural anesthesia was also associated with a significant increase in malposition, 4.4% versus 18.8%. P is less than 0.05. I don't know what that means. Cesarean delivery occurred more frequently in the epidural group, 2.2% versus 25%. P is less than 0.05%. That must be the margin of error. Primarily related to an increase in cesarean section for dyskadia, 2.2% versus 16.7%. Again, margin of error is 0.05. Conclusion. In a randomized controlled prospective trial, epidural anesthesia resulted in significant prolongation in the first and second stages of labor and a significant increase in the frequency of cesarean delivery, primarily related to dyskadia, which I think is a fancy term for failure to progress. There's also the less intense methods, such as suction, forceps, etc. Each of these has a much higher risk of complications and side effects than the typical vaginal birth. Epidurals have been proven to have a negative effect on the infant. As well as just mentioned, epidurals increase the need for instrumentally augmented vaginal delivery, which has its own repercussions. For the baby, instrumental delivery can increase the short-term risks of bruising, facial injury, displacement of the skull bones, and cephalohematoma, which is a blood clot under the scalp, Buckley. The risk of brain hemorrhaging is increased more than 4 times for the infant delivered with forceps rather than spontaneous delivery, Buckley. Epidural drugs do pass directly through the placenta into the fetal bloodstream, essentially giving the infant an adult dose of whatever medications have been administered. It takes 8.1 hours for an infant to metabolize what the mother can metabolize in 2.7 hours, Buckley. During the labor, there is an increased likelihood in fetal respiratory and heart rate distress, lowered blood flow to the placenta, blood oxygenations, and blood pressure changes, which can create a real medical emergency, placing the fetus at risk. One disturbing side effect is reduced reflexes that enable eating, namely rooting and sucking. Immediately after birth, these infants usually have a low APGAR score. It is possible for the mother to develop maternal fever or blood pressure changes because she was unable to sweat after the epidural was administered. Either of these may result in the infant being removed from the mother for further testing, intervention, and possibly including spinal taps, treatment by antibiotics for non-existent infections, sometimes even being kept in the hospital after the mother has been released. James and Buckley. Less radical but still concerning is that infants whose mothers used epidurals are distinctly more